It's possibly the worst time of the year to try to stop the spread of a virus in China. Hundreds of millions of people are crisscrossing the country this week to celebrate the Lunar New Year with family. Since its outbreak in the city of Wuhan, the deadly virus has jumped a number of international borders, prompting large-scale screening measures at airports, bus and railway stations. Containing the virus is an absolute priority, as quickly as possible, because there are fears that the virus could mutate.
The evidence shows that the disease is currently transmitted through the respiratory tract, and there is the possibility of a viral mutation.
In an attempt to minimize the risk of contagion during the current travel rush, a number of airlines and railway companies have announced they'll waive cancellation fees for trips to and from Wuhan. The city's mayor has also warned against travel to the epicenter of the outbreak and urged the people who are already there to stay. Some people have cancelled their trips due to the current situation, but it's unlikely to stop the majority from travelling. For many Chinese, the Lunar New Year holiday is the only chance they get to see their relatives all year.
Chinese state television reports that the death toll in the outbreak of a new coronavirus in China has now jumped to 17, with nearly 500 confirmed cases. Well, there is now growing fear that the disease could spread, and several countries are screening transit points for ill passengers. Well, the virus is on the move, and that's what makes it so scary. Hong Kong and Macau have confirmed infections. Other regions have also reported a handful of cases. Thailand, Taiwan, South Korea and Japan, and also the U.S. Well, the World Health Organization is meeting in Geneva to decide whether to declare a global public health emergency. Well, health authorities have traced the virus now to a seafood market in Wuhan. Well, they're still trying to figure out the exact source and how it is adapting, but they have confirmed human-to-human transmission.
The evidence shows that the disease is currently transmitted through the respiratory tract, and there is the possibility of a viral mutation.
All right, joining me now for more on this story is Dr. Mohammed Munir, a virologist. Doctor, so good of you to join us from Lancashire. One of China's top health officials that we just heard there announced that the virus could mutate. Now, as a member of the general public, hearing mutate, that sounds really scary. Does this mean that it will make it more contagious?
Well, matter of the fact is that viruses always mutate. They have a tendency to change their shape. They have a tendency to evolve. So that's not new. The important thing is that whether that change or whether that mutation would have any impact onto the disease outcome, or the severity would be increased. So if we look onto the history of these viruses like SARS and MERS, which are relative to these coronaviruses, there are highly probability that these viruses, if they mutate, they will be more stable, they will be more fitter, and they will sustain in the population for a longer time.
Now, Doctor, the World Health Organization is holding an emergency meeting as we speak. It is rare for the WHO to declare a global health emergency. It has not done that as of yet, but when it does do that, what does it actually mean?
So since the placement of the rule, WHO has only placed the emergency 5 times in the last 20 years, and all those have been on viruses. So in the current situation, although the virus is emerging in all dimensions from inland to overseas, and the human-to-human transmission is there are relatively less chances that there would be an emergency in place. But that all depends on what the situation will come up and how the official will decide today afternoon. But there are relatively less chances that emergency would be put in place.
Mm-hmm. Now, Dr. Munir, of course, this is the flu season. So how can we tell whether we have contracted this very contagious disease? What are the symptoms of the virus and how can it be treated?
So the virus itself causes pneumonia-like symptoms. There would be a problem with the breathing. There would be pneumonia. There would be fever. So whenever these kind of situations comes in, there is literally no treatment or vaccine available at this moment. The only possibility is the personal hygiene, staying away from uncooked food or direct contact with the animals, and sort of containing yourself for longer travels or in contact with the other healthy people. So that's the only thing that can be done at an individual level at this moment.
All right, Dr. Mohammed Munir joining us from Lancaster University. Sir, thank you so much.
Pleasure to be here.